Good afternoon. My name is Eric Bennett. I want to thank everybody for coming out today. This is our first membership meeting since we've gone to the kind of quarterly feel. Last month, obviously, we had some weather issues that prevented that meeting. We have a great meeting for you today, and I appreciate the great turnout. We've got the presentation today is on the affordable health care, and we'll let Dina introduce that. I know Dina just now handed out the minutes, but if you guys get a chance, if you would look at that, and I would entertain a motion to accept those. And this will be from the November meeting of last year. Like I said, this was slated to be our first quarterly membership meeting, which we missed in February. So if you get a chance to look through those. Okay. Martin and Steve, thank you. All in favor? Aye. Opposed? Okay, so moved. I'd like to do an introduction to guests. Do we have any guests present?
New guests.
New guests?
Jill is new.
Jill?
Want to
You want
introduce
to introduce
yourself?
yourself?
Sure, thanks. I'm Jill Caddy from Proper Studios Model Works, new to the town, new to the area as of the end of October. So glad to be here.
Welcome. Thanks for coming. We also have the new regional director for the external affairs for AT&T, Craig Belzine, is with us. He was actually here from '86 to '96, during which time he was supportive of the Bastille Days. They also sponsored our Great St. Louis to St. Genevieve bicycle race in '88. He's been here and helped sandbag many times, and now he's back as our regional director. So I want to introduce Craig. We have contact information for him should anybody need to get a hold of him, and we're glad that he's back. We'll go on to get this started. The last newsletter came out just recently. One thing that I wanted to touch on really quickly was the letter on the back pertaining to the membership dues increase or change. We recently formed a committee and went through and reviewed our old due schedule. It had not been updated in several years, about 8 years. So we formed the committee and made the proposal for the new change. So that there may be some change there, and if you have any questions, we'd certainly be happy to address those and discuss kind of where we ended up with those. But we did want to make you guys aware that there was a change in that. Also, we're coming up on the end of the term for the chamber, so there's our election will be in April for new board members. We have a panel of nominees, but if you guys have any suggestions, certainly talk to Dina or myself or Linda Hook to be put on that ballot for the chamber board nominations. So is anybody willing to throw out a suggestion now, or like I said, you can certainly nominate later. So, but it will be for the next meeting, the next board meeting. So get a hold of us if you have anything. Also, in addition to the due schedule, we have reviewed and revised the bylaws for the chamber, which are under review now with legal advisor, and that will come up at our annual meeting, which is next month at Shawmette, and Dina's going to discuss the details of the banquet here in a second. But it will be a membership election for that, a ballot election, which will be held at the chamber meeting, which will be in April. So be on the lookout for that when you come, and make it out for the benefit. Make sure and get a copy of the ballot and let your voice be heard for the changes to the bylaws. And I think that's all that I had. I will turn it over to Dina to discuss the details of the banquet. And again, I appreciate everybody coming out today. Thank you.
The annual banquet coming up in April. It's going to be April 25th. This is going to be the last Friday of the month. It will be held out at Shawmette Winery. We have several changes with this banquet. One being that we normally seat 300 people. This year we are only going to seat 200 people. The reason for that is we eliminated the tent, so all those ladies and gentlemen who sat out in the tent for the last 2 years in the cold and the rain, we have taken that element out of there just to make everyone comfortable. In doing so, that took about 100 chairs away. This was not an easy decision for us to make, but we wanted to make sure that everyone was comfortable and they're all treated the same. The other aspect was you couldn't hear us really well when we were doing our awards presentation, so that we didn't want to cause any further confusion with that. If you paid a ticket and you're in the tent and you're cold and then you can't hear anything, then what did you come for? So to alleviate all that, we wanted to make it a very nice evening for everyone. This will be our 90th chamber banquet, so this is a milestone for us, and we do have a couple of nice little prizes that we're going to give away as well for the evening. Ticket prices will stay the same at $25 a person. I cannot stress to you enough that tickets are only 200 seats limited. So when you get that email about tickets are now on sale, I would not procrastinate in getting your table. The other change is there will be assigned seating. We have not done assigned seating in 10 years. The reason that we're doing assigned seating is because we want to make sure that out of those 200 seats that all of our seats are filled. So if you have, I don't know, I'll look at Lori and Paul Herzog, for example, because I can see him. If they come with 2 other people, say Regions Bank, and there's only 4 in that group, but there's 6 more seats available at that table, I'm going to seat 6 more people at that table. So there will not be any empty seats at all. So just know that you can still reserve your table of 10, and that's your whole group. The hospital reserves 16 seats. So they're going to have their one table of 10, and then their other 6 seats will be with a group of 4. The reason that we're doing that is also because, like Eric mentioned, there will be a ballot given to chamber members at this banquet. That ballot was to take a vote on the bylaw changes. Actually, I don't even want to say changes because it was a complete overhaul. Bylaws had not been updated since 1986. It was definitely time for that to be done. And again, if you are the guest of the chamber member, you will not vote. If you are the spouse of the chamber member, you will not vote. Only chamber members will make the voting decision. For example, the hospital is a platinum member, they get 5 votes. Tom can cast all 5 of those votes at this meeting for his hospital, for anybody else who wants to do that. But a spouse or a guest who is not a chamber member or affiliated with that hospital would not be able to cast a vote. So does everybody understand that? Okay. Like I mentioned, it will be out at Chalmette. The doors will open at 5:30. Because it is our 90th year, we are going to kick off with an hors d'oeuvres social hour, which we've never done before. We have always just done a networking social hour, but there will be some food available and drinks as well. So this is going to be a really nice event. Tickets go on sale March 24th at the chamber office, and they're $25 a person, limited 200 seats. Any questions? Okay. Before I go into the program, are there any other business or announcements that need to be shared with us at this time? Sean?
Hi, I'm Sean with the Friends Foundation at the hospital. I just wanted to let everyone know that we have 4 big events coming up this year. I have a save the date flyer that kind of gives an overview of it. We have our Art of Women's Health Walk, our Ride to Survive, our Golf Classic, and our dinner and auction. The Ride to Survive and the Golf Classic are both in June. And actually on the other side is the sign up and the registration for the golf class. Most importantly, if you look on the page, there's people outside having fun, which, that's something that we haven't done in a while. So hope to see everybody there at one of the events, and you too can have fun outside eventually.
Any other announcements? Media announcements? Okay, well with that, I'm going to introduce our program today. Gina Harper, navigator for the Affordable Health Care Act. She is employed with East Missouri Action Agency out of Park Hills. Her and her co-founder, Jeremy Marler, and 4 other counselors are currently assisting individuals, families, and small businesses with outreach, education, and enrollment activities for the ACA in the counties of Jefferson, Bollinger, St. Francis, St. Genevieve, Cape Girardeau, Perry, Washington, and Madison counties. So they have a very busy and highly important job. So with that, Gina and Jeremy.
Thanks, Nina. Thank you, everybody, for coming. I appreciate your time, and I hope that the information that you received today is going to be helpful, will help answer some very basic questions or maybe some rumors that you have heard. Again, I'm Gina Harper, and I am with the East Missouri Action Agency. Jeremy and I were both hired at the same time, strictly for the Affordable Care Act. That is our positions. We do outreach and we do counseling, which means we do sit down one-on-one with individuals and with business owners and talk about what your options are. I'm doing pretty good right now with my voice, but I don't know how long that's going to last, so I'm going to do the first few slides and turn it over to Jeremy, and then I will pick up again at the end. Like I said, we do cover various counties. I'm mostly in Perry, Cape, and Bollinger. I am also very good friends with Nina, which is another reason why I'm here. And I'm helping out Jeremy, whose territory is rather large also, but specifically Texas and St. Genevieve counties as well. So East Missouri Action Agency has the grant through the Missouri Foundation for Health to provide assisters, that's one of the strange words, assisters to individuals and businesses to help them understand the Affordable Care Act. This first slide, it says the insurance marketplace. It has the word exchange at the bottom. For those of you who don't know, marketplace, exchange, and healthcare.gov, it's all the same thing. It is that website that individuals or businesses go to see what kind of plans are out there. So you've also heard the term Obamacare, I bet, and the Affordable Care Act. Those two terms are interchangeable as well. So we know where we're starting. This presentation is going to talk about what individuals need to know and what their deadlines are to register to get some health care, and then what business owners need to know. Deadlines are completely different. What's required of them, of an individual, is completely different than what's required of a business. But the reason we're going through both today for you guys is because if your business is small enough that the ACA doesn't apply to you at all anyway, Jeremy and I are here to encourage you to let your employees know that there is possibly some affordable care out there for them, and to go out and at least talk to us or go out to the website, healthcare.gov, and put in some information and find out, because you may be surprised by the end of this presentation what's out there for some of your employees. If you're not going to offer the coverage because either you don't want to or don't have to, that's great, but if you'll help us get the word out to individuals, we appreciate it. Okay, so the overview of what we're going to do, we are going to talk about what the Affordable Care Act is. It did come out in 2010, and the goal was, of course, so that everyone in the U.S. is covered under some form of health insurance, and the place you go out to do that is the marketplace, or the exchange, or healthcare.gov. It's all the same thing. What's it mean for individuals and businesses? We'll talk about that. There are federal subsidies. People have heard the term. They don't know how you get them. They don't know how they work. So we're going to explain what those subsidies are to help individuals pay for their plan, okay? And we're going to tell you how they work. The guarantees and usage requirements. You can't just get health insurance because you want it, because the law says you have to. There are some rules, and we will talk about that. There's people that are going to be exempt from getting health insurance, and we'll talk about who those people are. The tax credits, then we go down to the business side, the tax credits and the penalties for businesses if the business size requires that you get health insurance for your employees. We'll talk about what those penalties are and how you can get extra incentives through tax credits in order to provide it to your employees. And then the very last slide, we'll show you the website and give you some phone numbers on where you can get help. The two things that were passed out, thank you, Dina, was again, some individual information, and then some small business FAQs, and there's a tax credit scale on there as well for businesses. I like my little true or false questions because I've been asked some really squirrely questions out there, and a few of them I've thrown up here, so I just kind of want to gauge where everybody's at and what they think they may or may not know about the Affordable Care Act, so just kind of shout out what you think, true or false. The ACA means everybody automatically gets health care. False. Correct. Individuals will be fined $95 a month for not complying. False. There is a penalty, but it is not $95 a month. Individuals will be forced to buy insurance no matter the cost. False. There are exemptions, and one of them is for affordability. There are some rules, though. What you think is affordable may not be what you think is unaffordable may not be what the federal government thinks is unaffordable. Individuals who can't afford it don't need to do anything. False. Okay. because we can help that individual get an exemption if it is unaffordable to them. So what we don't want anyone to do is just not do anything because they've heard a bad rumor or they don't know, they think it's gonna cost too much. Just don't not do something. Just talk to us and we'll make sure, if we can, if there's an exemption available for it, we will get it and that individual will not be penalized on their taxes. Cancer or diabetes will cost you more for coverage. False. Pre-existing conditions have been done away with. You're not even asked a health question on the exchange, or if you call the 800 number, the customer service line, you're still not asked any previous health questions except for one. Individuals who use tobacco products are going to pay more. That is absolutely true. That is the only, I'm not even sure it's considered a health question, but it's the only health question I can think of that you're actually asked. And if that answer is yes, you will pay more. And I have seen the rates jump. Rates in the ACA are expensive and unaffordable. Some people are going to say that's true. It depends, okay? I can't really say this one's probably true or false. What's affordable to me may not be affordable to you, but it is based on a set guideline of your household size, your income, the county you live in, and your age. So all of those things come together, and we'll talk, and so we'll see some slides coming up where you can see, you know, based on some of the same information, what people are paying differently for health insurance. Business owners have nothing to worry about until 2016. That is false. 2016 is a new date that has come out. That just came out February 10th for businesses with over with over 50 employees. Businesses that still have over 100 employees, the business mandate applies to you in 2015. And it will be strictly worded up here. I'll show you a slide. Large businesses just need to offer some kind of coverage. That is false. There are requirements, and they're called minimum requirements of what you can offer as a small business. If you're going to do it, your employees are probably going to appreciate that, but there are some rules that you need to follow when you do offer it. And anyone can still buy insurance plans outside the marketplace. That is true, okay? Jeremy and I, again, we are paid through East Missouri Action Agency. We're not paid through any insurance companies. We don't get a commission, nothing like that. We're paid our hourly salary for running around all of our counties and talking to folks. So if you come to one of us, what we're doing is telling you what the ACA is, and then we're helping you get on the computer, get on the marketplace, healthcare.gov, and look at, based on your personal information, what your plans would be. We can help you pick one. We can't tell you which one's better than the other, okay? We can go through the rates with you. We can go through what co-pays are with you. And then we talk to you about what's important to you. How often do you go to the doctor? Do you want a lower monthly payment, or do you want a higher deductible? Or, you know, we go through those kind of things. And then you, as the individual, have to make that decision what you want to do, okay? We can't steer you towards one or the other. The only two plans in Missouri, though, only two insurance companies, I'm sorry, in Missouri are Anthem Blue Cross and Coventry. So we can tell you about those two companies, and then you make the decision on what you want to do as an individual. Okay. And I'm going to turn it over to Jeremy.
Basically, we're going to go through a few more slides here. Let me go to the other side so I can flip the screen here. How the marketplace works. There's two different insurance companies, but there's an array of plans. There's not just two different plans. You have the bronze, you have the silver, and we'll get into all the different levels, but there's multiple plans to fit various needs. You know, you got higher deductibles, lower deductibles, higher copays, lower copays. So it's kind of, you know, there's different plans to fit everybody's needs. There's financial helps available. We'll get into both of them here in just a little bit. They're called cost sharing or tax incentives. Unbiased help is like me and her. We're not like she said. I don't sell insurance. I help people. I show you what we can do for you. I'm not here. You know, if you buy a plan or you don't, it doesn't matter to me. You don't pay any money while you're here with us. We don't charge anything for what we're grant funded. It's a free service. I've had a lot of people come in thinking that they were going to pay something where they came in. It's a free service. I don't charge anything. We're here to help the public, educate them, show them what we can do for them, and then if they choose a plan, they can choose it. If they don't, I've printed the plans out so people can go home and study them. You know, some people pick plans, some people will decide that they're not gonna do anything and pay the penalty. It doesn't really matter to me, like, you know, I'm not a high pressure salesperson or anything, so, easy registration online, or you can go to the 1-800 number. There's private insurance companies to compete for your business. There's also brokers out there that are selling insurance. They're selling the exchange things, and I've had several of the brokers contacting some clients that have came to me afterwards. Please let your employees know to be cautious with the brokers, because I've had them sell them bronze plans that cost them $0, but they say they have to sign up for several different things in order to get them plans. So just tell them to please be cautious when they're dealing with a broker. I'm not a broker, so I don't get paid to do this stuff, so I'll explain to them everything. The silver plans, the gold plans, the brokers tend to steer away from that. They'll give them the free plan so they can upsell them on insurance that they get paid on. Two type of ACA mandates. You got the individual and the small business. Individual coverage, they're gonna have to be covered by March 31st. You've got the deadline coming up. And then you got the small business, the shop. Businesses with 50 or more full-time employees is gonna be by 2016, like she said earlier, if they're more than, 100 employees, it's 2016, so.
2015.
2015.
2015 for 50 to 99, and 100 or more is right now.
These are the 5 important factors for the new individual mandate. Preventative care, and then required essential benefits. A lot of your preventative care is gonna become free. You know, under the insurance companies, you'll get like blood screening once a year. You can do your preventative checkup once a year. A lot of them services are free. It just depends on how the insurance company lists them. You just have to contact the insurance company once you get done. Inside and outside the marketplace, pre-existing conditions are eliminated. All plans inside the marketplace are reviewed for acceptance. So far, just Anthem, Blue Cross, and Coventry have been accepted into the marketplace. I'm sure in the years to come that more insurance companies are going to jump on board, but these are the only 2 companies that have done it so far. Lifetime or annual payouts are removed. That means, you know, if you get cancer and you hit $500,000 where the insurance companies used to give you the boot and say, we're done, we can't pay any more money for you, that's eliminated. They still have to keep you, they can't cancel you because you've gotten sick. And then your children are allowed to be on your parents' plan until age 26. Some people are very agreeing with this, and some people are like, what in the world? And then below, the Anthem, Blue Cross, Blue Shield, and Coventry are both the providers. These are the essential health benefits. It's basically underneath an umbrella. The insurance companies have to cover these items in order to be a qualified health care plan. Ambulatory services like doctor's visits, emergency room visits, hospital stays, counseling, preventative disease management, prescription drugs, maternity and newborn labs, physical therapy, dental and vision is for pediatric only. And then I've also seen that they cover some hearing aids, they do cover chiropractic care, and there's some other things that the insurance companies actually offer. So in some instances, it's better insurance plans than some of us already have. Minimal essential coverage. If you have some of these coverages here, you're actually considered covered, and you're not allowed to go out and get tax credits in the marketplace. That would be Medicaid, Medicare, Children Health Care, which is Missouri Health Net, Missouri, TRICARE, employee coverage, veterans coverage, individual policies, or marketplace policies. So if you have any of them coverage, you're actually covered, and you don't have to go anything. You're going to avoid the penalty by having that coverage. Here's the different levels of plans. We've got bronze. It'll cover about 60% of your cost. Silver will cover 70% of your cost, with the exception when cost sharing discounts are offered. They're only offered on the silver level plan, and the reason why they're only offered on that is because that still gives people the low cost bronze plans that they can get at a very reasonable rate for the people that can't afford to pay for, silver or gold level plans. And then also the cost sharing are on a sliding scale. So as you get towards the top of the cost sharing, the gold plans, some of them are actually going to look a little more enticing because you're going to still have the lower deductibles. So that's why they do that. And then we have the gold plans that are 80%. And then for anybody underneath the age of 30, we've got the catastrophic plans. That basically is a very high deductible plan. They'll get a couple doctor's visits in case they're sick, and then, you know, a couple preventative care visits, and that's about it. What is the federal subsidies? There's two different things. One of them's cost sharings. It's going to reduce your out-of-pocket cost. It's going to be lower your deductibles, lower your co-pays, and lower any of your out-of-pocket costs. The premium tax credit is going to reduce your monthly premium. That is based on your income. They'll decide what you get, and then you'll get that, and you can use it towards your monthly premium. These are the guidelines for the federal poverty level. These are actually 2013. They were in your flyers, but if you look over on the back, they've actually upped them just a little bit. I think probably because the minimum wages came up just a little bit. So the federal poverty levels have came up. Like last year, it was $11,490 for an individual. You were considered 100% poverty level. Now it's $11,600. And I'm not going to go through all of them because I mean you've got.
Jeremy, before you go off that, will you explain 100% and below 100%?
From 100% to 400%, you're going to get tax credits. For a family of 4, you could be up to $94,000. I think it's a little bit more than that now that it's came up. You're going to get tax credits on a sliding scale. Your credits are going to be really great at 100%, but as you get to 400%, they're going to fade out, and that is to help you pay your monthly premium. On the cost sharing, it's going to be anything from 100% to 250% poverty level. You're going to get cost sharing, and it's also on a sliding scale. They start out really good at 100% poverty level, and as you get to the 250%, they're going to fade out.
And then if you're below 100?
Yeah, if you're below 100, that's going to be where you're in the gap in the state of Missouri. They've chosen in the state of Missouri not to expand Medicaid so far. Don't know if they're going to. You know, we're hoping in the future they're going to expand it because there are still a lot of people in the state of Missouri that are not going to be covered, which was essentially the plan was to get everybody covered 100% across the U.S. Because of us not expanding the Medicaid, there is that gap. Once you get below 100% poverty level, you're going to have to pay full price for insurance because you're not offered any subsidies because this program was designed to help the people between 100% and 400%. If you were below that, you would have been on the expanded Medicaid. And these people that would have been on the expanded Medicaid, they're not the people that are laying in a home in bed collecting a check. These are your regular people out there working. It's your people at McDonald's, your people at Walmart, your people that's at the checkouts at your grocery stores. I mean, it's the people that need the insurance. So I'm hoping that they come back and expand the Medicaid and do what's right for the citizens of Missouri. But as of right now, then people are exempt. They still have something to do. It isn't that they just forget about it and say, oh well. They still have an exemption form that they have to fill out and stick a stamp on it, mail it in, and they're going to mail them back an exemption form or an exemption letter determining their taxes, and then they will not be required to pay the penalty. Is this one you wanted to explain?
Oh, yeah.
You kind of typed it up in your little letter explaining.
Kind of going back to the last slide, this is an example of what's going to happen. We have Jeff and Julie, same ages as Paul and Linda. So again, there is no longer a discrimination for male and female. Whereas in the past, if you were a woman, you know, we had babies and the hysterectomies and all those problems. So women were usually charged more for insurance. Not anymore. Men and women, same age, same county, are going to get quoted the same rates. Okay. So here's our example. Jeff and Julie are in Cape County, and these are actual real rates. I looked them up, made a little dummy of them. So they make $32,000, and Paul and Linda only make $13,500. One more. The subsidy that Jeff and Julie gets, because if you look on your chart, as a family of 2, they're getting $583 in subsidies. What that means is the federal government is going to send $583 to the plan that they choose, and they pay the difference. For Paul and Linda, they fall below on your chart, which Jerry was just saying, when you fall below 100%, it assumes Medicaid would take care of you. Medicaid is not taking care of you in Missouri. So Paul and Linda get 0 subsidies. So even though they make less money, they're going to be asked to pay $587 for the same plan that Julie and Jeff are going to get for $4. And one more, you can see what the other plans would be. For silver, $143 for Julie and Jeff, $726 for Paul and Linda, and and then the gold plan. There are no platinum plans in the state of Missouri, by the way, which is why I kind of crossed that out on your list. The platinum would have offered a 90% coverage. So there's your example, and you can see it's exactly the same rates. If you add $583 and $4, you get the $487 that poor Paul and Linda have to pay. So what we do for Paul and Linda, we know that they can't afford $587 a month. And the bronze is the highest deductible plan. So it would be difficult for them to pay that or meet their deductible at all on their salary. So what we do, like Jeremy said, is make sure that they don't get penalized on their taxes for not having insurance. And we do that by giving them the form so that they get an exemption. They get an exemption letter. And then next year we tell them, hey, next year when open enrollment comes around, let's talk about, maybe you have new jobs, maybe, something's changed for you. We'll see if we can get health insurance for you next year. This year, we're recommending the sliding scale clinics. We're recommending the hospitals that do the grant programs. I mean, and they will continue to get the kind of care they've been getting or not going to the doctor at all, which in some of them, that's what they've been doing. So, and unfortunately, yeah, I've had people go, I haven't had care for 10 years. I think one more year is not going to matter. So that's the sad part. So.
Individual exemptions from the tax penalty. Undocumented immigrants, those incarcerated, people who don't have affordable coverage options, religious and conscious members. There's some of the religious organizations that have their own type of cost-sharing health plans and stuff. These are some of the hardship exemptions that they can apply for. If somebody's had a recent eviction or pending eviction, bankruptcy in the last 6 months, homeless, consumers are ineligible for Medicaid based on the state's decision not to expand. These bottom hardship exemptions, they're going to fall back into the thing that we said. Them people are going to be in the gap that can't afford insurance. I mean, they just cannot afford to pull it out of the money out of their pocket because it would be either pay for insurance or pay for food on their table.
Jeremy, I want to talk about that 8% because we haven't brought that up yet. Affordable is less than 8% of your income. So in the very beginning when I said, doesn't matter what you think you can afford, it's what the government says is the formula, and that formula is less than 8%. So I have gone out to the marketplace with a couple and tried to help them with insurance. Less than 8% of their income was $202 for a couple. And this is a real example, happened the other day. The insurance that we found for them was $187. So it was under 8%. The federal government says they can afford that, okay? She said to me, we can't afford that. I was hoping for $50. It was actually 20 something until we had to add in that they were both smokers, and then it went up to 187. And so she was ready to pay the 20 or, but she couldn't pay the 187. But it was still 8%, less than 8% of her income. So for her, we can't help her and say, okay, let's fill out an exemption form because it's too expensive for you. According to the federal government, it wasn't too expensive for her, okay? So that's where that 8% comes in. In their case, she said, well, let's just stop. I know we don't have $187 a month. So they will be paying a penalty at the end of the year on 2 adults. Okay.
Is this where you want to take
Yeah,
it?
I'll take it. Okay, so again, we kind of told you the basics of the individual side. Again, as business owners, as folks that work with employees, if you're not offering insurance or your mandate doesn't take effect for a while, just let your employees know that maybe we can help them individually. I'm going to talk more about the business side now for a few minutes. This really bothers me because it's called SHOP, but that's not the acronym. I'm a journalism person and this really bugs me. But they're saying Small Business Health Option Program, they call it the SHOP. It should be a HOP, but it's not. So what the SHOP does, it's also online alongside the individual plans that you can go out to the website. There's a bar for individual, there's a bar for businesses. We're still getting this SHOP thing up though. So, and by we, I mean, I guess the federal government who's trying to build a website. So right now the SHOP website is just not what it needs to be. I wouldn't recommend going out to it. By the time businesses need to by the end of this year to look at what's happening for 15 or 16 for them, I think it'll be up and running. But again, it's going to do the same thing that the individual side does. You can compare plans. You can see if you're eligible for a tax credit, and we're going to talk about what those are. It is for-profit and nonprofit businesses, okay? So don't just think, well, we're not profit, there's nothing we're going to get or nothing we need to do. It is going to be open when it comes online for businesses with 50 or less. And then by 16, it'll be open for businesses with 100, up to 100 employees. Okay, here's where we start with some of the rules, okay? And Dina, if you like, I could send this presentation as a PDF if you don't write this down and you want to see this. Okay, so starting in 15, so this year, businesses with 50 to 99 full-time employees will pay a penalty if they don't offer coverage or they don't offer coverage that's affordable and meets minimum value. Okay? And actually, no, I have redone this presentation. Okay. Let me do one more slide because this is not correct, and I apologize, group. I've redone this and I have it like saved 3 different places. Starting in 2016, okay, this should say 2016, with 50 to 99. Yes, 2015, it is still effective for large employers that have 100 employees or more. So I apologize for that. That should say again, starting in 2016. If a business, there it is. If a business has 50 to 99, there's your 2016. They will pay a penalty if they do not offer coverage that is affordable and meets minimal value. Minimal value is that bronze plan. Okay, I'm going to show an example of it. Affordable is a different number. We talked about 8% a while ago. The affordable number now is 9.5%. If you offer coverage to your employees, they have to be able to take it and pay their portion, okay? The portion of what they have to pay out to take your insurance has to be less than 9.5% of their income. If it's not, they can go out to the marketplace and see if they can find something cheaper, okay? If you are a small business with under 50 full-time employees, you don't really have to do anything. The law doesn't apply to you if you're under 50. There are some incentives if you do, and they're called the tax credits for you as a business, but you don't technically have to do anything. If you want to, you can go out to the shop, again, the online shop part and do that. But again, it is up to you personally if you want to do that. Okay, I worked for a small business that had 5 employees and he offered insurance to us. It just depends on what your company wants to do. In that case, now that business would get some pretty good incentives for tax credits. Okay, and there's what I handed out on that page that has 2010 through 2013 and then 2014 going forward. You can see based on employees and wages what kind of tax credits you might be eligible for. Okay, so the bottom line, if you have under 50 employees, you technically don't have to do anything as far as the ACA is concerned. If you have 50 to 99 by 2016, you will pay a penalty if you don't offer insurance, or if the insurance you offer is not 9.5% of the employee's income or less. And it also has to meet at least a bronze plan. The penalties if you don't do this for a business in this range, it's $2,000 per employee after the first 30. Okay? Or there's an additional penalty of $3,000 per employee that goes out to the marketplace and can get insurance cheaper than what you provided. Remember, if it's 9.5% or less, they are obligated to take it from you. Okay? They can't just say, like my example of my couple, 202 was the cutoff, the plan was 187, and they still said, no, we can't afford it. So they would not be able to go out to the marketplace and find something else. So as long as you're in those guidelines. For the tax credits, okay, if you want to look on that sheet, it is a sliding scale, and this is the tax credit for the business, not to be confused with the individual that gets some subsidies that we just talked about earlier. This is tax credits for the business. And here's what applies for those. From 2010 to present, if you have fewer than 25 employees, their average wage is less than $50,000, and you pay at least 50% of their premium. If that's anybody in the room, there could be significant tax credits for you, and you would go back to your earlier dates if you've been providing health care and look that up and be able to get those subsidies. The biggest bang for your health care buck is for those businesses with 10 employees or less. Okay? With an average wage of $25,000 or less, which kind of goes back to that business I talked about in St. Louis that I worked for. We had 5 of us. That was our wage. We were around $25,000. There was 5 of us. They paid 90% of our premium. We paid an extra, $20 every 2 weeks. So it was a great deal for us. They could, as a business, get some serious incentives for doing that. Okay, now they could going backwards. So again, here's kind of the quick overview. It is on a sliding scale. So if you have up to 25 full-time employees, the total amount paid for premiums, okay, it's 35% tax credits from 2010 to 2013. It's up to 50% tax credits for 2 consecutive years from 2014 and beyond. It's not every year from 2014 and beyond. It's 2 consecutive years, whichever years you want to do that. And then the criteria that you have to meet is you are paying their expenses, the premium, okay? They do include dental, vision, and long-term care in this, which I thought was interesting, because that's not part of the ACA, okay? The tax credits do not cover the premiums, though, for the owners, okay, or anybody in their family. So if you have a small family business with, 1 employee and six brothers, it's not really gonna count for you, okay, because it's not family members. And talk to your CPA or your accountant, because you can amend your taxes going back to 10 was how far you can go back on this. Big note though, contributions to your premiums when you do that are tax deductible. When you get penalized, it is not. This website, not that any of you are going to be able to write this down or can see it probably from the back of the room, but like I said, I'll send this to Dina, has a wealth of information on it for the employee tax credits, okay? And who is an employee and how do you figure wages? What is a full-time employee for the ACA? It is 30 hours, it's not 40. Okay? So I encourage you to go out and look at this website. Real quick though, again, the owner is not counted towards tax credits. Part-time workers do count because you're adding up and you're dividing. Family member does not count. Seasonal workers don't unless they work more than 120 days a year. And leased employees do count. So if you've got a full-time person that you're leasing, but they use your office, they come into your building every day, they've got a parking pass, then they are going to be considered an employee under this law. So if you do offer insurance, okay, regardless of your size, if you do, you do have some requirements. This is where I said you can't just offer something, okay? If you do have to offer it to all of your full-time employees, which is 30 hours, okay, under the ACA, not 40. So again, why you've heard some businesses have cut their folks down to 28 hours, 29 hours, that's absolutely happening, okay? At least 70% of them has to sign up for it. So you want to get their input long before you decide to go out and pick a plan, okay, if you're going to do that. Large companies, you guys have already figured that out with your brokers and things like that. But a smaller company, if you haven't done this and you want to start offering it, you really need to poll your group of employees and figure out what's important to them as far as, is it the higher deductible, is it the lower monthly payment, what are we looking at for the employees, because at least 70% of them have to enroll in it, okay? And that means it has to be affordable to them. And it has to meet that bronze value. So you can't offer a plan that is below the 60-40 split that Jeremy talked about earlier when we had that screen of bronze, silver, and gold. Okay? That is the lowest level. That's what they call the minimal value plan, the 40-60. I do know my brother-in-law is a manager at McDonald's, and his corporation as a whole has gone through the bronze plan with very high deductibles. Okay, here's just an example. Again, it's gonna be hard for anybody to see in the back, but an example of a premium less than 9.5%. So my example is a worker's paid $35,000 a year. His or her share of the premium has to be less than $277.08 a month. Okay, that's the 9.5 example on that. The plan picked has to be at least the bronze, and it has to meet those 10 essential benefits that Jeremy showed. It's a blue screen, ambulance, maternity, all of those things. So for those of you who have heard, and I heard it at Christmas was not fun at my house. I heard it at Christmas, people saying, my family saying, but my brother-in-law so-and-so, they liked their plan. It was just fine. They got a note that it's canceled. It was $200 a month. Now they're going to have to pay $500. Absolutely, okay? Because the new plans did not meet those 10 essential benefits, okay? I use the example, they were driving an Escort before that had 4 tires and AM, FM radio. Well, all the new cars now are Cadillacs with navigation systems and, you know, so Sirius radio. So it has changed, okay? You can't pick and choose your insurance plans anymore. They all include the same things. Some important rules, okay? It is based on your geographic area. Remember I said age-wise, as long as you're the same age, male or female, in the same county. My example was exactly the same. You live in a different county. Reynolds County has different rates than St. Louis and Cape, okay? So it does make a difference. Tobacco use goes up. I've been asked, what if I just answer no? I say you have to be as honest as you can. I can't tell you what to do. I can only help you answer the questions, but your insurance company will drop you, and they have a right to drop you for not paying, and if they find out you have lied on the application, okay? And depending upon what kind of health care you get, what kind of diagnoses you get when you go to the doctor, whether you get stuck on the patch to quit smoking and you've answered you don't smoke to start with, those kind of things can come back, okay? The 1.5, and again, I have seen it, so let folks know that. And it's not a yes or no, do you use tobacco, do you not? I mean, that's just too easy. It's a convoluted, have you used tobacco more than
The last 6 months.
more than 4 times in the last 6 months, other than religious reasons? So, so most people just, yeah, okay. So, and then an employer can receive some discounts, okay? For offering some additional wellness activities and things like that. Those are added on. You can't offer less than those essential benefits, but you can add on a few things more if you want to, as an employer. Okay, quick example, and I know we're almost finished, Dina. Quick example, I keep talking about if the employer offers it, make sure it meets the minimum requirements. I think we've all worked for companies where our insurance may be paid, or it may be very low, like mine. My employer paid 90%, so I could afford the 20 bucks that I had to pay. Or I worked at the university, it's 100% paid for the employee. So Joe, in my example here, Joe's gonna take it from his company because they pay almost the full premium. But companies aren't offering to pay for a spouse or a child. The insurance is there. The opportunity to take the insurance is there, but nothing is paid for the employee or the child. And in this case, this is the example. So Joe makes $28,000 a year. His premium is basically, you know, it's A-okay, because it's only 2.8% of his salary. So of course he's gonna take that, 100 bucks, that's nothing. But he doesn't have a lot of options on what to do for his wife and his kids, okay? He can pay the full price for coverage under his employer, which is well over, you know, $1,200, okay? He obviously can't afford to do that. The problem is, it's offered as his employer. His employer offers the opportunity to buy insurance. They don't pay anything, but they offer it. Joe can go out to the marketplace and try to cover his wife and kids, but he's not allowed to get any subsidies to do it. Even though a household of 4 with 28,000 may be in that range. I'm not looking at the paper, but it may be, okay? Maybe at 35,000, for example. So his only other option is not cover the kids and the wife. Take it at work, go out to the marketplace, see if he can find it cheaper than $1,200, which he probably can, or just pay the tax penalty on an adult and 2 kids and not have anybody covered, okay? So there are companies that are dropping their health insurance for their spouses and for the kids for this reason. I don't know that this rule is gonna change in the marketplace. It seems like every day Jeremy and I wake up and something new has happened with, with the ACA. So I don't know if it's gonna change or not, but you guys need to know that if your employer is trying to offer insurance and think you're doing a favor to your employees, you may or may not be, so it's something to look at, okay?
Something I've asked, some of the people that I've counseled, they've been in this predicament, and they can't afford to do it. I've told them to go back and ask their employer to evaluate if anybody actually uses that service, and if they don't, ask the employer to quit offering it so that they are allowed to go out to the marketplace. So it's something, you know, our company actually did at East Missouri. We went and evaluated to see if any of our employees were using it, because we're kind of in the same predicament. And we had 4 employees that were using it, so they're not gonna drop it. But next year, we are gonna definitely consider probably dropping it because of that fact, letting our employees go to the marketplace and cover for cheaper. So it's definitely something.
Something you wanna look at, yeah, exactly. We've talked about the tax penalties. We already told you the 2,000 and the 3,000 for businesses. This is the individual penalty. It's not $95 a month. The first year, everything I'm hearing, and correct me if anybody out there has heard wrong, it is 1%, $95 or 1%, whichever is greater. Everything I've heard says it's probably just gonna be the $95 just because it's new for everybody. But after that, I mean, it is gonna go up. There are tax penalties, okay? So that's why we just keep telling folks, yes, you know, you may not be able to afford it, but we don't want you to pay $95 at the end of the month, at the end of the year if you don't have to. Or you may be really shocked because you may be one of those people that can get insurance for 20 bucks. Why pay a $95 tax penalty if you really can have insurance all year? But we've got to figure out your household size and your income. We just want to sit down with you and talk about it. This only goes to 2016. I don't know if that's coincidental to the election year, but that's all the further we've been given rates. So those are the rates for that.
We don't know if it's gonna extend any farther. I mean, we don't know if that 600 and something per person's the end, or if it just continues to go up.
Yeah, every year. We have not heard anything about that. So I do encourage employers to go out to the Fair Labor Standards Act on the website. You are required to let your employees know right away after they're hired, within 30 days, whether or not you're going to offer them insurance. Some companies had a 60-day, 90-day, 6-month probationary period. It has to be 89 days or less at this point, okay, your probationary period. Because with the ACA, individuals are going to be penalized if they go more than 3 months without insurance. Okay, does that make sense? That's why you need your probationary period when someone's starting with you. If they're just waiting to pass their probationary period to get their insurance, it needs to be the 89 days, because on the 90th day, they need to be able to have insurance. Okay, just quick key points to remember. The marketplace, it's that website. It is for individuals and businesses. I encourage businesses not to try and do it yet, but towards the end of the summer, I think we'll have that site up and running for the shop site. Individual mandate is absolutely right now. So anybody you know that's not covered, that just wants to know, needs somebody to talk to, needs somebody to help them through the website, March 31st is our deadline. Unless they have some sort of qualifying event after March 31st, they get married, they lose a job, they have a baby, they move, something other than I just procrastinated, okay? We can help them after March 31st, but it has to be some kind of life-changing event, okay? It will continue to be sold outside the marketplace. There are very great, honest brokers out there that are helping, and that's what their job is to do. You as a business, you work with Blue Cross Blue Shield, you work with Aetna, whatever, continue to work with them if you want to, okay? You can certainly do that. So Jeremy and I are really here to help on the individual side and just let you guys know what the business rules are, but continue to work with your broker, or we can help you as well. And then the marketplace used to be, and this is just now changing, and I haven't even changed this slide, used to be the only place you could get your tax credits. So if we went out and helped you on the marketplace to get those tax credits for the individuals, now brokers are able to help you with that as well, okay? So if you do go to a broker, they will take you out to the marketplace, this screen, just like we do, okay? And they can look at the rates. I do believe they get a commission from the companies, and that's completely between them and the insurance company. Jeremy and I do not. Very quickly, I want to show you this screen. This Cover Missouri has some great information out there for businesses and individuals. I highly recommend that. Healthcare.gov has some great information. But this is the screen we pull up when we help individuals. And this See Plans Before I Buy button is the very first thing we do. And that's exactly what I did when I put in Paul and Linda and Jeff and Julie or whatever, and I made them a family of 2 living in Cape, making 34,000, whatever, and it will spit out almost to the dollar of what the premium would be and what kind of options you have. So anybody that can use a computer can go out and do that. Now, when you click apply now, then you've got to create an account and you've got to do some other things with healthcare.gov, and I think that's where some people are a little shaky and they want their hand held a little bit and they want to be talked to, and that's great. Jeremy and I, if you're sitting there, we can key your stuff in for you if you're sitting there. But see plans before I buy, it's a great tool. It wasn't active, a couple months ago. It is now, so I highly recommend it. And you'll be able to see whether it's your son, whether it's some friend, if you know their income and their household size, you can find out real quick.
You can look at every insurance plan, all the different bronze plans. The silver, it even shows the cost sharing difference in that. It shows everything down to, like she said, just about $1 of where it's going to be if you go in and put all your information in, as long as you use the same income and the estimator or the calculator as to what you do in the application. It's a really great tool. Most of the people that I talk to on the phone before I even make an appointment, I click through that calculator just to kind of let them know what I can do for them or if I can even help them.
Or if they'll be coming in to get the exemption form, they'll know in advance. That's our presentation.
Does anyone have any questions for Regina or Jeremy?
Well, no, see, sorry, that shows you the tie-ins to the federal plan now. But then we use two plans that satisfy all the federal government.
Yes. Missouri is a federal marketplace. We didn't create covercalifornia.com or something like that, like some states made their own exchanges. We are using the healthcare.gov exchange. We're using the federal exchange. Yeah.
How do you determine income?
Employee income or individual income?
Individual.
Okay, it is a guesstimate,
It's a
which
projection.
is my favorite word. It's a projection, I guess that's a better word, of what you're going to make in 2014, because this is healthcare for 2014. So the household income, if it's the family of 2, is based on, they say husband and wife in my example, what they're going to bring in 2014. There are some stipulations, things that aren't counted, okay? So we have a list of those things. And when we figure it out, I've had people go, okay, I've got unemployment for 6 months, then I had this short job, I think I'm gonna be working, but I'm always off at Christmas, so that's 2 weeks. We're going back and forth, and we're deducting money, and we're adding money, and we're making sure we get almost exactly to the dollar that we need to be at for what you think you're going to make. I can lose my job tomorrow, you can lose your job tomorrow, that might happen. But we have to be as honest as we can in what we think you're gonna make based on what you're doing right now.
But on the other hand, this is all reconciled on taxes. So if somebody does lie, it's gonna be reconciled at the end of the year, and if they lied and said they're gonna make $20,000 a year, when yet they made $60,000, they're gonna owe some money.
But is it like a line off of your taxes, off of your tax form? Is it your adjusted gross income?
It goes off your line 30. It goes off your line 37, your adjusted gross income after expenses. So if you have your own business, it's your income after expenses is what line we look at on the tax form. And when we got somebody that's self-employed and stuff, we typically look at their taxes is how we determine it and try to project how they're doing. Obviously there's no science to it. It's just a guesstimate. And that's all you can do is just guesstimate. Like she said, you could be fired, or you could lose your best client. There's a lot of different things that could happen to change things. And if that does happen, if you do lose your best client or something, you can actually call into the marketplace, let them know that your income has changed, and they can adjust your tax credits. In some cases, if you lose your job, maybe your tax credits are going to be more, or in some cases, maybe you gain a few clients and you're not even going to be eligible for tax credits. That way, you don't get to the end of the year and owe a bunch of money, or you could get to the end of the year and have a bunch of money coming to you if they owe you a little money.
So all these plans also include dental and vision, right?
No.
This is health only.
You have the option to buy dental plans through the federal marketplace, but the vision plans they're non-existent. There isn't any vision plans.
Did you say that? Yes.
Why does it vary by county? Is it population, economy, or what's the variance there?
Cost of living in the counties, you know, obviously what you would spend on insurance in St. Louis is different than what you spend in Wayne County, for example. So it is based on the county that you live in.
And if you know, we've noticed too, like, if you go up to Jefferson County, there's more Coventry plans available, as if you go into St. John County or Cape County, it's more on the Anthem side. So different counties offer, you know, a little bit different plans and stuff as far as, usually the providers change just a little bit.
Are you finding a lot of problems with one or the other of these insurances won't cover the doctors that you have? They have specialists?
In some cases, yes. In some cases, some of the hospitals are still arguing out the cost. Like, for instance, I don't know if any of you know BJC, Parkland, and Farmington. They're still arguing and they refuse to take Anthem, which in St. Francis, St. John County, Anthem seems to be the less money of the policies. Coventry's a little more expensive, but you know, I can't change BJC's mind. They're gonna have to come to terms. You know, or most people are picking the Anthem plans. I mean, I'm not persuading them to pick Anthem. They're just going with the cheaper of the plans, and BJC's gonna be sorry down the road if they don't change their mind. I mean, I'm not being mean or, you know, it's the way the world is. You know?
Well, what I tell individuals is what I know of the institutions, and that's, right now, it's the BJC system, obviously, but for my area, Cape, Perry, Bullinger, it's the difference of St. Francis or Southeast Hospital. So it's those two systems. St. Francis does not accept Blue Cross Blue Shield. And so I let them know that. And I say, you have to make that decision. You know, if you're partial to St. Francis and you have a doctor you don't want to switch, you will be out of network if you take an Anthem plan. You just need to know that. I don't steer them to the other plans, but I tell them what accepts and what doesn't. And right now, that is the only one that I know of.
One more question, sorry.
Okay.
Is there going to be like an open enrollment time and a life crisis or whatever change will be that you can enroll? How's that going to work?
Well, a life change, like I said, the baby, the married, the move, you know, some of those kind of things, that's pretty much any time after March 31st, because that's a change you couldn't help. If you lost your insurance at your job, you can't help that. So you have an open enrollment time just as soon as you can, okay, when one of those events happens. But for anybody else that just procrastinated, doesn't have one of those things, the next open enrollment isn't until the end of this year for insurance starting in 15. All right, thank you very much. If you have individual questions, mine and Jeremy's cards are up here, and we'd be happy to help you. Thank you very much.
Just a side note too,
Hang tight, hang tight.
one more second. We haven't really firmed up this with Jeremy and Gina yet, but we are kind of working on it. They are trying to make themselves available to come into our chamber offices and sit down one-on-one with businesses if they need help. So we know that their time is very busy, and we're trying to allow them to get what they need to get done first before we, ask them to do that service. But that is a service that could be offered in our office. If you need help to come in and sit down with them one-on-one, they will take the time, and we will schedule, an hour block or whatever, 45-minute block for you to do that with them. But we'll let you know that information as soon as we kind of firmed up their schedule and our time. So, is there any other business? Okay, well, we will see you, most of you, I hope, all of you, at our April banquet. If not, we'll see you May 1st for our next quarterly meeting. Dermot?